And so today we're talking about how you can actually manage a practice where you have patients that are coming in for more than one specialty. Now, this specialty requirement does not mean that it has to be something fancy. You can have somebody who has a care plan for acupuncture, a care plan for massage therapy, a care plan for chiropractic, but places where we've seen it more useful is where practices have opted to use multiple active care plans for physical therapy, for MDs, for weight loss, for nutrition, for detox, for chiropractic, and some of which are all of the above and more. So the why we're doing this is care plans are great. They do lots of great things for you, but we're going to actually get into the old care plan versus the new care plan and why you should use the old one and why you should use the new one and what their differences are today. So that is the goal of today's discussion. So when we start talking about a care plan, why on earth do you want to actually use a care plan? Now, this is a situation where it really doesn't matter if it's a cash patient or an insurance patient. When you have a new patient that walks through the door and they're going to enter care, the main reason for doing a care plan is to put a financial agreement in place with that patient that says, okay, over the course of the next 10 weeks, you're going to come in for 60 visits, and we are going to agree to pay this much money for your care. Now, that much money can be broken down into insurance versus patient, or just patient money, but you didn't necessarily outline every single CPT code that you're going to bill because you can't at that point. But your treatment plan includes, over a period of time, how much that patient is going to pay. So I clicked on View Care Plan for our specific Genesis test patient here. And as we're looking at this, we're going to break it down, and I'm going to get pretty specific here. So this training isn't typically for the first time somebody is actually reading a care plan. And what that means is we have a care plan here, the first one that we're looking at, and I'm not going to explain it necessarily on the screen yet, but just theoretically, if you're going to have a number of visits, you do have to put how much money is going to be charged per visit. So this top line here, the highlighted blue line is what we're talking about. If you don't know exactly what you're going to bill, each time a visit is billed out, you have to go in and manually adjust whatever it is you billed to what you agreed that you are going to have the patient pay. That is very time consuming and very difficult if you have to do it on a not only a patient by patient basis, but a visit by visit basis. So what the care plan does is allow all of that to be automated as long as you set it up in the first place. If you've got one patient with one specialty, that has worked well for over a decade now, and many of our users have found that super useful. But as practices have changed and began to evolve, the need has also changed. So if you have multiple specialties, you can still use a single care plan, and we'll illustrate that today, and we'll make sure that we go through what your options are. But your primary goal for a care plan is still to have the manual adjustments that you would do on a visit-by-visit basis to bring down what the patient responsibility is going to be automated. That is the purpose, to automate the adjustment of those charges down to what the patient actually owes. That doesn't change no matter what. So even if we're talking about multiple active care plans, we are still going to do just that. We're just going to help you do it and track it in a slightly different way so that you can discuss things with the patient more easily, you can hold clinicians responsible for what they're doing, and ultimately the patient should have a better experience. So enough of the pomp and circumstance. We're going to actually get into the nitty-gritty of this. So the first thing that you're going to see here is this highlighted line is, yes, we have an active care plan, 36V for 2015, 36 visits. All right, and this one is starting from 11/23 of 2015 through 12/31 of 2016. It's a long care plan. However, if you move over, this is a really traditional care plan, probably the most popular, 36 visits. And you'll see here you have insurance visits in this first drop down. You've got your used, your dollars per visit, and that's all for your insurance. So in this particular case, there's zero insurance visits planned, 0 used, and the expectation is $0. So this is a private pay patient. There's 36 cash visits, 5 used so far, okay, and they want to pay $45 per visit. So what this means is no matter what is billed out, you could bill out $2,500,000 on a visit, and it was going to adjust that charge down to $45 for that specific visit. And there was 36 total visits that I was going to do it for, but from any visit that was billed out within this date range, okay, from the date that it was created, it's going to subtract 5 visits out of that total. So the first 5 are not going to be billed out, and then anything after that will be adjusted down to the $45. If you just have chiropractic, as I mentioned, it's fine. This next column are free visits. How many free visits are used, and how many, well, free visits don't need a specific dollar amount because you know what the dollar amount is. So in this particular case, there is no column for that. Some of our practices still use free visits, but it's not that popular, frankly. So our recommendation is use sparingly or don't use it all. That's fine. So as you move down here, and you can show, this is where you're actually going to fill all of that out, all right, and save any updates that you have. And so we're going to go through now how that would look for an insurance visit. So if you had somebody who had, let's just say 12 insurance visits, they use 0, and they're going to pay they're going to have a $25 copay per visit, let's just say. So you're going to have, that in there, and you want them to pay an extra 20 bucks. So you're going to have $45 for their visit as well. You would, if you're going to add 12 insurance visits, but their still total care plan is 36, you're going to have 36. You're going to take that down to the 24 to represent all of your visits. And let's just say they've used none of them at this point. So you can change how the system is going to handle a cash visit versus an insurance visit within a care plan. Now, keep in mind, I didn't go over the scheduling portion of the care plan, and we will do that a little bit later in the webinar. So what if I wanted to charge more or less during the insurance visits? Well, we can do that. We can go ahead and say, all right, for the first 12 visits, we're assuming these are insurance, and I want the patient to pay only $25. If you sold a care plan, right, to a patient for $1,000, and you expect that the insurance company, based on your normal CPT codes, is only going to pay $600 of it, then you know you have a $400 balance left that you have to charge out over 36 visits. If you do that math, it's $11.11 a visit. So how do you want the patient to pay for this? Do you want their insurance visits to be free? And then do you want them to pay the difference over the remaining 24 visits? We don't dictate how you are going to do that. You have options. However you do the math and you want to implement those visits being adjusted is up to you, but the system will do it. You simply need to make sure that if you are going to bill out insurance visits and you have an estimate of what the insurance is going to cover, you go ahead and work the remaining patient responsibility out over the remaining visits. That is an explanation of how the care plans work at this point. But if we were to move this in a different direction, right now, this care plan with this new feature here is covering, I'll just get rid of psychiatry for right now, it is covering 3 different specialties: chiropractic, physical therapy, and occupational therapy. So any visit billed out under these 3 specialties will be included in this care plan. The question is often asked, well, how do I know which specialty I'm talking about? So I'm going to save this update here. I'm going to close this up. All right. If you have more than one specialty within your practice, how do you know you're billing out under one specialty or another? Well, each one of your schedules has to be connected to a specialty. So each time you check somebody in, it's under a specialty. If you go into your billing and EHR screen, you can change that. So certain things are automated, but if you get in here and you want to change the rendering physician, you can. If you do change this rendering physician and bill out a visit, you are going to subtract a visit off of that active care plan because it covers all specialties. However, if you want to put in a care plan that covers all specialties, you'll have to up the visit. So the patient's going to come in 36 times over a certain period, but they're going to see the physical therapist on 24 of those visits, the chiropractor on 36, and the weight loss or nutrition on 12 of those visits. Now, how do you manage that? So this is really where it gets a little bit more difficult, and I'm just going to change that. So in that scenario, if you're going to have one care plan over all specialties, you actually have to add the 36 visits for the chiropractor to the 24 visits for the physical therapist, and then you have to add the 12 visits for the nutritionist. And the number you put in here has to be an average over all specialties over all visits. I'll say that again. If you're going to use one care plan that covers all your specialties, you have to be able to do the math over all of the visits that are going to happen across all specialties, and the amount that you charge per visit needs to be the amount across all specialties that you would expect the patient would have to pay for their care plan as a whole. So if I had 12 insurance visits for chiropractic, I had 12 insurance visits for physical therapy, and 0 for nutrition, I would add the 12 and 12 up to the 24. But I had 36 visits that I needed to have for chiropractic, plus the 24 for physical therapy, plus the 12 I needed for weight loss. I need to have a total of 72 visits here. I then subtract that from the 24 that I already have in there for the insurance, leaving me 48 cash visits. Why is it this way? Because as insurance is billed out, the insurance is always going to do what the insurance does. If they're going to pay $300 for the visit, or they're going to pay $3 for the visit, the system will then reduce the patient responsibility down to whatever you say here. So I'm going to say that one more time. Insurance will do what they're going to do. The care plan does not affect what your insurance is going to cover, what they're not going to cover. It doesn't adjust the charges prior to submitting a claim out. This is a rock-solid process that only affects the claim after it is adjudicated. So you're going to do the math on the number of visits, the number of covered visits to start with. The number of total visits then are going to be, you're going to subtract the number of insurance visits from the number of total visits for your remaining cash visits. But the entire care plan still needs to be calculated on what the patient responsibility is. Is anyone confused yet? I think you might be, because this is how we had set it up for a long time if you had multiple specialties. We are now offering a way to make this much easier. That's a lot of math, it's a lot of tracking, and even more importantly, it's a lot harder to have a discussion with your patient. So if we are able to add new care plans in, and so we're going to go ahead and click down here. Oh, it's going to make me save this because I made a change. So if I want to click on a new line here, I can now create my PT care plan, 24, excuse me, you got to get that, 24 and 12, meaning 24 total visits, 12 covered with insurance is just one naming convention I see. If I do that, I then come down here and I start typing in my specialty, physical therapist. It will only allow you to type in things that are available to your practice. So if you start typing in cardiologist, and there is no cardiologist in your practice, never fear. It's not going to set up a cardiology care plan for you. So you'll see here that I only have one physical therapist. Okay? Start date, I'm going to choose November 1. And my end date, I'm going to choose just the end of the year here. Insurance visits, 12. Used is 0. I expect there to be a $35 payment per visit. And then I expect cash visits there to be 12. And I want the patient to pay $50 per visit on that time. I come to that math arbitrarily here, but you can come to it by understanding what the insurance is and isn't going to cover as a part of their physical therapy care plan. So free visits, I'm going to put 0 in here. Here is another part. We've gone over this on other care plans, but this is going to affect two things, right? Your expected insurance collection can actually affect some automation in the system that will tell you. And the other thing that it affects is if you do put in expected insurance collections in here, and you can start running reports based on all of your patients telling you whether or not you are or are not modeling your insurance collection expectation correctly. We've gone over that in other webinars. We're not going to go over it in detail today. However, you can see that there is no asterisk there. You do not need to fill it out. So the other reason you use the expected insurance completion date is if you're working one case on an account, such as a PI case where you expect there to be $5,000 paid within dates of service from September 1 to December 31, and a January 3rd date of service gets paid from their major med because you switched back over to Blue Cross Blue Shield, it will or will not count that based on whatever dates you put in here. So now you've set up a physical therapy care plan. We save it. Now, under specialties, you can see that there's only physical therapy. In this particular case, when you click on that care plan, you can see that there's only this physical therapy specialty code. This care plan will only take effect when somebody in the office who bills out underneath this rendering physician is a PT. So keep in mind when you're scheduling people, as you create the schedules, you're going to do so by specialty. If you check somebody in for a visit under the chiropractic and they pick up the physical therapy visit, they have to keep in mind that they have to look at the rendering physician on those accounts. And that's located right here where you see Amy Pond. All right. So I'm going to recap for us real quick. A care plan is primarily a financial agreement. It always has been and it always will be in Genesis. You're going to create that financial agreement with the patient, and when you do that, the patient at that point knows no matter what is billed out, I'm going to pay X number of dollars, and the system is going to take whatever charge put in there and is going to automatically reduce that charge by taking the adjustment of that charge down to the patient responsibility as it's set out in the care plan. The problem we're trying to solve is, instead of doing the very complex set of mathematical equations that I out there when going over how to do it in one care plan, we make it simple. When you do a verification of benefits for physical therapy, for chiropractic, individual specialty care plans, you make them active at the same time, and as you bill those out underneath the specialties, all of the magic, meaning the math and the adjustments that you wanted to take place according to your initial agreement, happen on the front end. So that is really the long and the short of what it is we're doing with multiple active care plans. Whereas before, you could only have one care plan. Now, you can actually have multiple active care plans, which will allow you and your practice to say set active, and now I've got 2 active care plans. So you see the second column here, deactivate, set active, and that allows me to do that. And here under the view, I can view receipts, payments, CPT codes that are included or excluded, the ledger and the logs of what's happened on that care plan. We know that practices are already using this. This feature is a couple months old. The reason we're having the webinar now is we know it's working. We've exposed it to enough practices where we feel really confident that those who are going to get it and use it are going to be able to do so with confidence. If there is an issue, always open it to the task, and we'll do our best to actually help put those bugs to rest as quickly as possible. But the last thing I said I was going to cover is under the More Make Care Plan, right now, you can put things on individual clinicians. If you want to do this, let's just say for I don't have a PT here, but let's just assume Paul Brown is our PT. You can come in here and set the 24 visits in our hypothetical situation for the PT, click next or click finish at that point, or you'll see that we added a feature of save and add more. So if I put in my care plan visits for Paul Brown, the physical therapist, I can click save and add more. Then I can come over here and do Amy Pond, my chiropractor, click and save more. So it's going to allow you to use this wizard in order to create all those multiple visits on different times the way that you want to for each individual clinician right at the beginning of the care plan. So we've made some adjustments to the Make Care Plan wizard as well to make this as simple as possible for all of our users out there who are actually utilizing the best practice, and that is to put their patients on care plans, whether or not they're all cash or whether or not they're insurance. So I'm excited about this new feature. I know a ton of practices are using it. We've got over 30 or so practices that are using it successfully now. Our hope is that you're listening to this, and whether or not you're considering bringing on different specialties, if you may need some additional coaching, some additional confidence that we can handle the billing or something else, the documentation of it, let us know. Get us a task open. We'll schedule a call, and we'll see if we can help you out. Most of the time, I've got a great deal of confidence that we can. And if you have multiple specialties and you're not doing it this way, get started. If you need more clarification, all of the members of our team are up to date on this, and we'd be absolutely happy to help you. So that will conclude today's presentation portion. I'll open this up for any questions that you guys want to chat in. I'm happy to take any questions about care plans, active, single, or otherwise. And if there's nothing else there, we can I can take questions just about anything or everything at this point. So I'll give it just a moment or two for some questions, and then we'll end if we don't have any. Just while I've got everyone's ear, if you're writing down a question, the CMS Meaningful Use Stage 3 requirements are out, and you're required to be on that EMR by the end of 2017, actually beginning of 2018 more specifically. We're looking forward to providing that and having that out, so look for updates from us on that, because just like when all of the other phases were rolled out, we'll continue to hold webinars and other training sessions to make sure you have that. Do we have the specialty of acupuncture physicians in your system? Absolutely. So that is a certainty. We've got tons of acupuncturists in the system right now. So I'm not sure we have an acupuncturist set up underneath our demo practice, but we do not under a demo practice, but we do have tons of acupuncturists. I know here in New Jersey, there are some great reimbursements coming for acupuncture, unlike other states where there are none. So, Lynn, I hopefully answered your question, but it's very popular to the tune of thousands. So, any other questions on the care plans or anything else? Lynn, you're very welcome. But if you have one provider performing multiple roles like weight loss, chiro, etc., do you need multiple specialty codes? That is a great question, Patrick. And the answer, you're not going to like the answer, is yes or no. Depends on how you want to set it up. The way I'm going to recommend it for anybody listening to this webinar, if you have one person who's doing multiple roles, set up 2 specialty codes for them. So you can set up, Brenda Smith under weight loss specialty code, which exists already. And you can set up Brenda Smith as a chiropractor, if she is one. And when you choose the rendering physician, you'll choose the right one, and they'll do it. Because the specialty code is the limiting factor for using multiple care plans. You need to have the specialty code associated with that physician in order to make them work. Patrick, let me know if that answers your question. If it doesn't, I can go into some other detail. I'm always thinking if it takes a long time to answer yes or no, it's a no. So I hope I can get some better details to you, Patrick, if that didn't help. All right. While we're waiting for Patrick, if there are any other questions, feel free to shoot them out there. Can you show us when we were billing on a travel card, how do we switch between specialty codes? The answer, Patrick, is absolutely, I can show you that. So in this particular case, I'm in the travel card. I see here Amy Pond, right? Now, Amy Pond here is not listed as a chiropractor, and she's not listed as a weight loss specialist or as a physical therapist. However, we can list her as Amy Pond chiropractor. We can list her as Dr. Adam Prescribe. This is another thing, if somebody's able to do something. We can name it out as massage therapist. So we can name this whatever you want on the travel card. So it's this drop down, and we can show you actually how to change those naming conventions to make it super obvious. However, Patrick, anybody else where this is a concern, is I still recommend creating the care plans with separate schedules underneath each encounter for a physical therapist, for weight loss, for acupuncture, for chiropractic. And when your patient comes to you, we want you to go to your specific roster, log in your visit only that you'll see, and that should be automatic. We don't want your clinicians spending a lot of time looking at this, making sure that this is correct, because that's a disaster recipe, and we don't want those clinicians to have to remember this. Time is of the essence, and we realize that, so you want to set this up from the schedule the right way, and most importantly, if you really want to make this good, get your patients a key tag, a code. We're coming out with fingerprint reading so that when they go into whatever portion of the practice that they belong in, whether or not it's chiropractic, weight loss, physical therapy, they check themselves in, and this handles itself automatically. So that is the best practice there. All right. Health coach specialty exists. Lynn, let me pretend it doesn't, even though it does for a second. So, Lynn, under the impression that it doesn't, we can create specific customized specialty codes for your office. So if you want to create something new and unique to your office, Lynn, we will create that for you. It will exist, and we can then create an active care plan underneath that specialty code for those patients and in your practice. Lynn, let me know if that answers your question. And let me just go down to Patrick. I'm skipping Susan for just a second, just to finish up Patrick. Yes, thanks. No problem, Lynn. I appreciate it. So on the schedule, if a patient was being provided weight loss and chiro on the same day, they would need to be scheduled on a weight loss schedule and a separate chiro schedule. Yes, that is exactly what I'm saying, Patrick. That is the best practice. You want to put them on there twice. There are a number of reasons you want to do this, only one of which is proper billing under care plans. The other one is if they come into one visit and then scoot out over another one, you want tracking of that. And if you don't think that happens, I would love to bring you over and show you some data on other practices. It does. So the tracking for both visits is crucial. And keep that in mind. I'm just going to use this opportunity to talk to you about another feature. When you do choose another clinician with another specialty, we have the ability when documenting to create separate threads on the same account. What I mean by that is totally separate from care plans. If you're a chiropractor and you log in and there's 6 chiropractors in your office, it should automatically open up the previous chiropractic visit, not the previous physical therapy visit, if that was the visit that was just filled out. So we can create the different threads on that account so that the right documentation, diagnosis, and procedure code set shows up correctly for each time that somebody logs in, no matter who the previous rendering clinician was. As long as they were the right specialty, we'll match those up. So that was just a 2-for-1 there. And Patrick, I hope that answered your question. If you could confirm, that would be great. I'm moving to Susan's question. If we have a patient on maintenance and they are in for a new maintenance care plan, we have to deactivate the current care plan and create a new one after we do this. It does not stay. Any suggestion? So I'm pretty sure I understand your question, Susan. I'm going to read it one more time to make sure I've got it. If we have a patient on maintenance and they are in for a new maintenance care plan, we have to deactivate the current care plan and create a new one. Yes, that is accurate. You can have 2 active care plans, but it's going to show you an error message if you try and create overlapping care plans for the same specialty. So you can't create a maintenance care plan for chiropractic that goes from September 1 to December 31st, and then try and create one that goes from December 1st through the next year, January 31st, for the same exact specialty. It will throw you an error. So if you have an existing care plan, but a patient wants to have a re-sign meeting, or you want to have a re-sign meeting and put them on a new maintenance plan, you are going to have to cut the current one short if it isn't going to, excuse me, I don't want to say it that way, if it's going to overlap is what I meant to say. So Susan, did I understand your question right? Did I answer it? If you could respond, that would be great. And Patrick, thank you for confirming that we covered your information. Yes, thank you. Any more questions? I'm not going anywhere. I've got another 20 minutes if we could use this. So if you have other questions, feel free to throw them out there. I'm here. If I can answer them, I will. If not, I'll try not to make something good up. That was a joke. All right, Lynn, how do you charge for what you do? Okay, Lynn, we work off of 2 business models, both of which are based on the same thing. One is full service, one is self-service. Full service means that we do all the submission for insurance for you. We do all of the follow-up and all of the posting, and we charge a monthly fee for that, and then a percentage of collections. If you are self-service, we still do all the submission for you for everything except for personal injury. Workman's comp, no fault, things like that, the things that you have to print and mail. If you guys choose to do that in your office, that's fine. For full service, we do all of that. And self-service means that you're going to do your own posting and your own follow-up, and then we charge a monthly fee, and it's really similar to the full service monthly fee, but then we just charge a per claim submission fee after that, and that's about it. There are a lot of other fees that you could opt to use, such as patient statements. There are other services that you could use, like reminder services, et cetera, that we do, that additional charges are levied there. So, Lynn, the question for fee for monthly, it's usually right around $299. Unless you're a 19 location, 45 clinician practice, we do have that, and then your fee is much, much higher than that. And we have to customize those. But for a single location practice, the fee is usually $299 a month. I hope I'm answering your questions for you. If that's not clear enough, we can certainly set up time outside of this. Okay. Okay, thanks. Pretty straightforward. And normally I have someone else moderating this. As I mentioned, my counterpart, no, not here today. I miss her more than you do. So any other questions? Give it just one more minute here, as always. I would like to thank everyone for coming today, for listening, for asking great questions. I hope that we were able to answer them well, and I'm hoping if you didn't ask a question, it's because the material was presented well enough that it made sense. If it didn't, or if you need more, please let us know. Open a task to us, and we would be absolutely happy to help you. I sincerely do thank everyone for coming, and we are not going to have a webinar next week, but we will the week after that, and then we start getting real close to Thanksgiving. So we'll see what happens after that. So thanks everybody, and enjoy the rest of your week. Oh, I have never done insurance filing. Is it possible to bill insurance without signing up with various companies? So yes, you can stay out of network with companies and just send them billing. The only caveat to that is some of them do require a credentialing application, Lynn. And what I mean by credentialing application is some of them don't know that you, if you're the doctor, or if you're working for a doctor, or some other type of clinician, they don't know who you are. So sometimes you have to fill out a credentialing form, which basically isn't a sign-up form, but it just says, I'm Dr. Lin. I went to this school. I'm an AP, okay? And I have this type of degree, and I've passed this state board. And if if that application is in order, then they recognize you, and you can send out claims. So everything else, we pretty much do that. And Florida is the state with the second most number of clients for us. So New Jersey #1, Florida #2 for us. South Carolina and Tennessee, gosh, they're just they're flying along. It's third and fourth there. So yeah, you can, for most payers though, Lynn, you can simply send in the first claim. It takes a little bit longer to get paid as they recognize you if you're out of network. But if you want more detail on that, we probably would have to set up a separate call to go over that. All right, guys, I'm going to end for today. Thank you so much, and good luck.